Hello, good evening, everyone. Welcome to the European Fertility Society. We are back once again today. I'm really happy to be here with Dr. Claudia Mika. You can see her right here. Hello, Dr. Mika. Lovely to have you back. How are you
Hello.
feeling? And are you ready to discuss our topic today?
Yeah, very good evening to everybody, and thank you for the invitation again. And looking forward to a good exchange with the participants later on.
Definitely. We are really looking forward to this event for sure. And let me just introduce Dr. Claudia Mika is the Executive Committee of the European Fertility Society and the Certification Committee Chair, as well as the founder and CEO of TIMOS International Healthcare Accreditation. And we will discuss today, as you probably already know, ISO versus PCCCP, so Patient-Centered Care Clinic Program. And we will start with the presentation first of all, but afterwards there will be time for your questions. So as always, please remember to put the questions in the chat. And I'm sure Dr. Mika will be happy to answer any of the questions. And well, as you probably know, we will be really happy to see your questions. And of course, we can start with the presentation, I think, right now. And let me just know if you can see us and hear us. You can see the presentation as well, and I believe we can begin.
Yeah, so I see the presentation. Thank you very
Perfect.
much for the introduction. A very good evening again from my side. Today I'm in Cologne, so it's evening, and if anybody of you is still in the morning or already later in the evening, welcome to this session. I was asked to describe or go into more details regarding the differences or perhaps similarities of the ISO standards, known as International Organization for Standardization, and the European Fertility Society's PCCCP program. So let's start with what is or who is behind ISO, what is ISO. You see here on the screen that ISO is an organization that was established already in 1947. It's a big organization with more than 26,000 standards. You may know from your area ISO 9001, where we have a deeper look into it in a minute. But they have many other standards, as you can see from the screen here, in different areas. And the standards are developed or supported by technical committees, which are more than 800. And you see its health is on the left side, but it's management, it's materials, it's building construction. So it's a huge variety of standards International Organization for Standardization has. When we look into what most of us know is ISO 9001, and I made a screenshot from the ISO website itself, then what it is all about. ISO 9001 is all about quality management. In other words, how to manage the quality. For whom are these standards useful or applicable? For any organization. It's independent of the size of the sector. So you as a clinic may have ISO 9001 implemented. You can go to your gym and you may see the certificate for ISO 9001. You may go to the supermarket and you see ISO 9001. It's completely unspecific. It has nothing to do with healthcare. It's a pure and only quality management system. Who is doing this? Who is certifying? Who is doing the audit? Any accredited certification body can do this. So you may know TÜV, TÜV is one of the big players, DEKRA, Bureau Veritas, others in other countries. So this is one thing I would like to mention already here, that the standards are developed by ISO, but any organization, any company, or you can found a company and can ask for accreditation, and then you can check and audit ISO 9001 or other ISO standards. And this is also the reason why we have so many certificates. So when I did my research, it was said that we have more than 1 million certificates worldwide in 189 countries. So this is ISO 9001, completely unspecific and a pure quality management system. Then, if we go a bit more specific into healthcare, we have a European norm. This is the EN in front of the 15224. This is only applicable in Europe or developed for Europe. And this norm specifies the minimum requirements of a quality management system in healthcare. So now we're getting a bit more specific and entering healthcare, but only in Europe. And this program covers all the requirements of ISO 9001, but in addition, we have some additional requirements specifically for the healthcare sector. In Europe, although it's a European norm, we don't find it very often. IVF clinics or reproductive care clinics in Greece, for them it's mandatory as far as I know, but in general you don't find it outside Greece. It's very rare that it was implemented in other countries, neither for reproductive care clinics nor in any other healthcare systems. Now, since 1.5 years, we have another ISO norm, which is 7101 in the version 2023. This is the first time ever that now another healthcare ISO standard was established. And from the website, I made a screenshot only with the benefits. So it's supposed to refine quality in healthcare delivery, improve patient safety, cost efficiency, effectiveness, and reputation for the organization. But again, we're talking about quality management in healthcare. So it may be a bit confusing and perhaps you have already a few questions, but these are the three main standards we should know when we talk about ISO, the 9001, which is completely unspecific, 15224 as a European norm, and now worldwide, the new one, which has to be proven or has to show that it is used and implemented, which is ISO 7101. When we talk about costs, and I did some research for ISO 9001 only, because it's very difficult to find reliable numbers and figures. It's quite intransparent. And the reason for this intransparency is because, as you saw on the first slide when I described who can check and audit ISO 9001 or the other ISO standards, it is that any accredited organization can do it. So they have their own pricing, their own fees, and this is why it is difficult. And we have quite wide ranges. I found that the first certification for small organizations, and I choose this because most of the reproductive care clinics are small organizations compared to hospital settings, and it varies between 1,500 euro to 11,000 euro. Plus, if needed, consultancy for the implementation of the standards from ISO, so where applicable. It's not included, it's only the certification, the visit, the audit, and the processing from the accredited body. Then in ISO, we have an annual surveillance audit, which is between 1,000 and 6,000 euro per year. And then there is the recertification after 3 years. Some of the organizations who certify ISO 9001 have the same costs again. Others say if we know the organization already, then it's less. So this depends on the certification body. So this is the overall overview for the cost for ISO 9001. If we now go to the European Fertility Society's patient-centered care certification program, then the difference is that the program owner is the European Fertility Society. And EFS experts developed this program, And the program is based on the EFS patient-centered care guideline. It is assessed by own EFS-trained assessors. So there's the first difference between ISO and EFS. This is our own program, and we do not ask any other organization like ISO to, or an accreditation body to allow us to use not owned standards for this program. When we talk about patient-centered care, I think we should have a mutual understanding of what we refer to. And we here refer to PICAR, which has a definition for patient-centered care, which is that this approach puts people at the heart of health and social services, including care, support, and enablement. It's an approach where users are recognized as individuals, encouraged to play an active role in their care, and where their needs and preferences are understood and respected. Those of you who are familiar with ISO 9001 may see that there is a difference from the approach between EFS and ISO. And what we specifically address are the specific needs of this specific patient group, of these humans in fertility treatment. This is very specific. And patient-centered care in fertility treatment should be, and this is what we expect, is respectful, responsive, and empowering. And it provides emotional support and improves communication. So in addition to the definition I just mentioned, this is how we understand patient-centered care in fertility treatment. And an ISO standard or norm cannot be that specific, for sure. So when we compare or go into more details to the patient-centered care certification specifically, it's a neutral third-party assessment conducted by the European Fertility Society based on own program criteria. And EFS, I hope you all agree, I'm sure you do, is a reputable organization confirming the clinic's patient-centered care approach, building trust, and reducing fears about quality, ethics, risk, and emotional stress for patients and relatives. This is what the certification program wants to stand for, and what we want the clinics to stand for when they go for this certification program. And therefore, the focus is a different one. And you see the last point here is quality management. So of course, for us, and when we go to the eligibility criteria, we see this, quality management is very important to us. It's one piece of the puzzle of the certification program. So trustful communication is part of patient-centered care. Then the environment plays a role. Emotional support, very important for patients. Personalized care for diverse patients. Qualification and development, leadership responsibilities, the team behind, the team that is taking care about the patient is important. The decision-making, the patient satisfaction, and patient experience are part of the certification program. And I mentioned the quality management itself. When it comes to the costs, we had the ISO costs before. So the cost here, the first certification, and we have GDP, the pounds is, I think, more or less 1.10 or something to the euro. So let's say it's more or less the same or similar. So we have for the first certification 3,000. We do have a first recertification after 1 year. We want to see that the clinic continues the good approach. Therefore, we ask for a recertification after 1 year. And then after this is confirmed, then we have the recertification cycles after 3 years. And you see that for each of these certification parts or milestones during the travel or the journey for certification, recertification, we charge £3,000. I would like to make a shortcut here and hope that it is obvious that when we talk about ISO certification and PCCCP, that we somehow compare not apples with apples. And this is where I might make a cut here, but we should compare apples with apples. Therefore, when we now continue and see the process, we should keep in mind that we are talking about two completely different certification programs. ISO, you have the order, then you prepare the quality documents, and then you have an on-site visit of the auditors. You submit it, and then you have the on-site visit. We may all know or not that even this on-site visit sometimes is not taking place. I have own experience from some of our customers in my other job, and we heard that sometimes the auditors are not even coming, but only do a check of the documentation from remote. This shouldn't be. So if you're going for ISO, you should really ensure and insist that the auditors are coming and see your organization and see your prepared documents and talk to the people. When we talk about the process for the EFS program, there is an application and a self-assessment. And I come to the self-assessment in a minute. Then after this is approved, the self-assessment by the EFS assessors, then there's an online interview with the different team members, from leadership to the quality team to the patient experience team, or whoever it is called. In a 2 hours interview, we will validate those information which was given to us during the application phase and in the self-assessment. And during the online interview, the assessors decide if and what kind of further evidence they want to see. This could be documentation, this could be a video, so that you can please make a short video to show us the treatment room or the waiting area or the laboratory, whatever. So this will be decided during or after the online interview, which is done by 2 EFS trained assessors. Who can go for the PCCCP? These are the criteria. There must be a quality management system implemented. And definitely ISO can be the implemented quality management system. So this would be complementary. Then we need to see an index of the quality management system documents, so that there, however it is called, policies, procedures, whatever we want to see. Then we need the confirmation that the operations are in accordance to a recognized code of ethics, could be the World Medical Association's code of ethics, another national code of ethics, association code of ethics. Then the operation must be in accordance with a documented patient care policy, describing how the clinic approaches, understands patient-centered care. And last but not least, it should be given, but we definitely demanded that the operation is in accordance with all applicable laws and regulations. I mentioned before that the application includes a self-assessment, and these are yes and no questions to make the applicant's life as easy as possible. So here are 3 examples. I read the first one. Is the treatment plan, including the schedule, provided and explained to the patient before starting the treatment? Yes, no. And if the answer is no, then you should, during the preparation, should change this to a yes, and should ensure that you can provide evidence to the EFS assessors that this is now implemented. And this is the system behind. So yes, no questions, which will be verified and validated in the second step, which is the online interview. So the patient-centered care certification is a structured catalog of questions which guides the organizations. Yes, no, yes, no, yes, no. And by this, gaps can be identified and actions can be taken. And by this, risks can be mitigated and errors can be reduced. This is the intention behind, not only to confirm that there is a very high patient-centered care already implemented, but also to help to get better. Staff is engaged, motivation should be increased, improvement is visible, and success is celebrated, hopefully afterwards. So this is why I said there is an interview where staff is engaged. And the focus on the program is the human, deserving the best care and treatment. So to summarize, ISO certification is definitely a good basis for the patient-centered care program of the EFS, but it does not replace it. So the scope is completely different. So when we said we have to compare apples with apples, and the completion of the EFS program marks a starting point, and the starting point is the promotion by the European Fertility Society across all the different websites, all the social media channels and other channels which EFS and the linked organizations do have. So this is the entry point to build trust, to ensure that it is really the approach is lived and visible, and then EFS is helping to share this good news via the different channels. And ISO certification, they are not supposed and they do not support the promotion of certified organizations. This is a complete different topic. They may list the organizations, but not even this is seen, at least what I did in my research, I couldn't find it. So there's nothing. So there's a certificate and this can be put on the wall and that's it. And then there is the recertification after some time. So again, it's completely different approach, which is good, which is healthy. And by having said this, I would like to thank you. I hope I could give you a little bit of an overview, and very much looking forward to all the questions and your comments and the exchange. Thank you.
Brilliant. Thank you so much indeed for your presentation, and of course explaining the differences about ISO and PCCCP. And of course, now will be time for your questions. So keep them coming and we will be happy to answer any of those. So don't forget, this is all for you. So if you have any questions, go ahead. I can see one question. But before we answer your questions, I have a few questions that I would like to ask before we continue with yours. So again, please keep them coming. I would like to ask you, as EFS Certification Committee Chair, patient-centered care clinic program, of course. Could you explain, let's start with that. Could you explain what motivated the creation of PPCCCP within the European Fertility Society? Let's start with that.
Yeah, thank you for the question. I think also from this presentation, it may have been obvious that we have a gap. So what EFS is offering, not only for this certification program, but as the European Fertility Society, is to be a strong partner for patient-centered care, for human-centric care. And when we did our research, we found, we have different ISO certifications. We do have accreditation. Of course, this is another step. But focusing on this, I would not even see niche, because it's not a niche. It's a requirement. Should be a requirement. Should be given to all clinics to accompany and take the patient's hand. We thought that we should, since we have the experts in the team, to prepare something where patients then can trust and patients can understand what is behind such a certification. We all know ISO 9001 from the different businesses and markets we have, but we will perhaps not bring together ISO with what is so important being a patient in such a sensitive area as fertility treatment. And that was the main, at least for me and for the colleagues, the main factor to dive a little bit deeper and to prepare this program.
Thank you so much. That's definitely an interesting discussion that we could explore for sure. So thanks a lot for that. And well, we are talking all the time about patient-centered care as well. So this is a phrase we hear many, many times. But it can mean different things as well in practice, right? So my question is, how does PCCCP define and measure the true patient-centered care?
So as I briefly introduced in the presentation before, let's take it very easy. The patient is in the center of everything. So whatever is done, the patient is the focus. So and everything is going around. So that's patient-centered care. We can have, as I had in the presentation, a more, let's say, research-related definition, but that's it. How do we measure? We have this catalog of 100 questions in the different chapters I presented. And we count and we measure by counting the answers, which we see as a yes, and we validate our measurement by the interview and by the provision of the written evidence or the visual evidence after the interview.
Yeah, all right, that sounds good. Thank you so much indeed for that. And so how do these two certifications, ISO, PCCCP, complement each other? Can clinics benefit from having both? You already mentioned that, but if you can explore
Yeah, of
a little
course.
bit on this.
It is not either or. It can be complementary. So ISO 9001 or 15224, if we talk about the European norm, or even the new one, 7101, can be an excellent basis. If it is properly implemented, we have those things which are all around quality management. So therefore, it's a very good basis, and one does not exclude the other. It makes definitely sense to go for ISO first and then go for the PCCCP, but both is possible and going hand in hand.
That's great to hear. Thank you so much. And my final question before we go for your questions, thank you for adding some more questions here and comments. So what aspects of fertility treatment are most visible to patients in your view? The things they really notice when it comes to quality and care?
I think patients feel what is going on. So patients may see certificates on the wall, but they don't know really what is behind, if we are really honest. There's a lot of education needed from all of us to educate not only ourselves, but also the patient. What is really a valid certificate? And what is coming from the printer, self-made, prepared, and is showing us something which wears nothing behind. But what patients are very sensitive, and patients in this area are their own experts. And if they feel well served, if they feel that they get the emotional support they require in their individual situation, if they see that all is done to have the highest quality, not only during the treatment, but also for the result, then they realize and they recognize it. And if this is then brought together with a patient-centered care certificate, then they will go and spread this message, and the word of mouth is then important. But this is how we have first to deliver, to let the patient feel and notice the difference between this clinic and this clinic.
All right. Thank you so much indeed. I think that is very, very important to ask and to remember. So thank you for that. And I will now go for your questions, and you probably can see the questions here. First, we have the question from Lee. Is ISO 9001 a prerequisite to PCCCP certification? If you can clarify.
So no, it's not a prerequisite. As we said before, it is very helpful and it's a good basis to implement a quality management system. Quality management systems can be implemented differently, can be an own system, can be done by our accreditation, national or international accreditation. So there are different ways to implement quality management, but there's no need, can be an own system and it would be accepted.
Mm-hmm. Thank you so much, Lee, for your question. I do believe it was useful, and now it's all clear for you as well. Next one is not actually a question, it's a comment, but let me read it to you. So, makes sense to create a specific certification for this scope. The patient category is unique in their goal. They are waiting to start their life with their baby, with all other patients' category expectations in other scopes in is to resume their life, right?
Yeah, true,
Thank you
true.
so much
Yeah, that's very
for
true.
that
Yeah.
comment. Brilliant. Thank you so much. If you have more questions, we still have a few minutes to wait and to provide you with more details. So please go ahead, type those in. If not, we will be finishing for today. But I already feel that it's been a really informative session. And I think that we provided all kinds of aspects about the pros and cons for sure when it comes to ISO and PCCCP certification. So please let us know. If you have more questions, go ahead, type those in. If not, we will be finishing. But of course, remember that we will be happy to take care of any questions later on. You can send us the questions directly to the team, and I would be happy to take care of those. And I do see one more question here. It seems that you do not use site visits or on-site audits for certification. Do you think conducting the entire process online is sufficient? And if so, how do you ensure it is properly managed? I think it's a very interesting question. Thank you so much.
And it's a very important question. Thank you very much for this question. And we had a long discussion on this internally. And we decided that for this scope we have here in this certification program, we will have the 3 phases of the certification, which is the application first, and we will only accept the application if the criteria which I showed in the eligibility criteria are fulfilled. And then that we do have an interview, that we do ask for evidence to be submitted, and then decide if the organization is eligible to receive the certificate. For this patient-centered care certification, yes, the answer at this stage is that we see from the first certifications that we don't need to do an on-site visit because of the interview and because of the visible evidence we have. We will have an evaluation about the feedback and the results after some time. And then we will discuss internally if we have to change something. From the moment from this moment, I don't see that we have to change it. We have also, because of the interview structure, we're quite confident that those organizations who apply for it really fulfill the requirements because of the evidence we see from them. But a very valid point, definitely. Yeah.
For sure. Thank you so much indeed. I think that was well explained now, but it's really important to mention that. So thank you a lot for that. And I don't see more questions, so I think we will be finishing for today. However, as always, please remember that if you wish to get any other information on PCCCP or you have any questions, we will be happy to help you out. So please just get in touch with us directly, and we will be happy to provide further details. Dr. Claudia Mika has been our guest speaker today. Thank you so much, Dr. Claudia. It's always lovely to have you here. Any final words before we finish for today?
Yeah, again, thank you for the invitation. It's always a pleasure to be with you and to have the webinar. And I would like to thank the participants for today because there were really important questions and comments, which, I will definitely keep and as a take-home message for myself to focus on this. And if I could explain the differences and when we talk about what patients really notice, I think this is the focus of all of our work, to have the patient, the human being in the center. Then I think then we reached a lot and we are on a good way. So thank you all, and I wish you all the best for your journey, whatever it will be as a clinic or as a patient. And yeah, looking forward to keeping in touch. Thank you.
Definitely. Sounds great. Thank you so much indeed. Have a lovely evening, everyone. And of course, we are here if you have any questions. So thanks a lot and hope to see you here quite soon as well. Take care, everyone. Have a lovely evening. Bye.
Bye bye.